The Federal Ministry of Health and Social Welfare has achieved a significant milestone with the signing of a Memorandum of Understanding with GE Healthcare and JNCI International to enhance biomedical engineering in Nigeria. The partnership aims to reverse medical tourism by providing world-class training to biomedical engineers, improving healthcare outcomes. According to the head of JNCI, Claire Omasheye, the collaboration combines practical experience and modern technology to train biomedical engineers, benefiting Nigerian and international students.
It has been a journey that didn't start today and won't stop tomorrow. And I'm really happy that we've come to this moment of a strategic partnership between the private sector and the public sector to really do what we need to do to increase the access to quality healthcare in our country. As you know, sir, there are three parts to make a hospital and get quality. First, you need the right kind of infrastructure. Second, you need to make sure you have the right quality of equipment. And third, you need to have the people. And I think that the people element is so important. So for us in the private sector to be working alongside the public sector and your schools to be able to upgrade the level of biomedical engineering is so important. If you look around the country, sir, as you know, we have graveyards of equipment. Some of them 1 year old, some of them 5 years old, some of them 10 years old. But the truth is that we need to be able to have in-country after-sales support, some of it at the hospital level, and some of it, of course, at the level of the OEM and the OEM reps like ourselves.
You know, at GE Healthcare, we are mindful of the fact that behind every equipment are people who work tirelessly to ensure that equipment are available and working seamlessly to save lives. And we are really happy that today we are creating a path for young engineers to gain real-world experience and practical application of their studies. We're also quite proud of the fact that we are partnering with academia and with governments to cultivate a generation of engineers that would have the skill and the passion and all the tools to support the transformation of healthcare.
Meeting people who have gone to different stages of training outside this country, bringing on all young ones, we in a way reduce the money the federal government is spending to send just one person abroad. Could that have been the pattern? Send one person from this institution, one from the other institution, at the end of the day. But we are coming into a situation where more than 10 persons from one institution can be exposed to such training.
The Minister of State for Health and Social Welfare, Dr. Morufu Tunji Alausa, highlighted the government's effort to revolutionize the healthcare system, citing the highest budget allocation in the health sector ever. The minister emphasized the importance of maximizing value from medical equipment and reducing abandonment.
When President Bola Ahmed Tinubu was campaigning around the country, he spoke honestly to Nigerians and said, you know, I would serve you and work for you as a president, and I won't lie to you. And he came in, took several difficult decisions that no past leader has taken in the last several decades. We know things are a bit hard, but we have to be able to bear short-term pain for long-term good if we have to survive as a nation. And that's what the president has done. But as president continues to do this, he realizes that a sector of the economy, the social sector that contributes to human capital development, education, health, and social protection. And he's put a lot of emphasis, a lot of funding. And we've witnessed that fact in the Ministry of Health. We have the highest budgetary allocation in the health sector ever in the last several decades. Now, the journey to today, signing in of MOU, didn't just start a few months ago. We've started a series of meetings, several meetings, starting with really doing diagnostic studies of what our medical engineering school needs. We've done curriculum development. Thank you, JNCI and GE, for coming to our aid, helping to update our curriculum to meet the test of time, to meet evidence-based learning. that any biomedical engineer or any biomedical technician should be exposed to. That's been done. We have also talked about accrediting the schools. We've worked with you to get all the schools to be accredited for HND, not just OND. And we're doing this in a way, in a very deliberative and calculative way, to make sure that engineers that we're training really have a good background to work as biomedical engineers, and also to expand opportunity to our millions of young men and women. So your school, despite being buried within a teaching hospital, you can expand capacity, train more, provide opportunities to more young men and women to go to school, get degree, OND and HND as biomedical engineers. And as they do that, they can come out being confident that they can actually do the work. So we begin to change the dictum, the arena that we have now, where we have a lot of abandoned equipment, and these equipments are very expensive. More so today, with the exchange rate, it costs a lot of money to buy several of these equipment. So we have to position ourselves in a situation where we need to get value for money and from this equipment, use them for years, if not decades, because we have to consider the replacement cost as well. So we've done that. We're also building a skill simulation, working on setting up simulation center that will expand the knowledge base of these trainees into the future. And also, your school, and perhaps I'm glad you're here, and I know you've heard, I've sent Dr. Pipi to you, the biomedical engineering school. You know, people that came to this ministry did some good work. They realized there was a gap in the service, in the manpower in our country. They set up these biomedical schools, just the way they set up the nurse tutors program that served the needs, the deficiencies at those times. Now we're happy today that we don't need the nurse tutor program. We've expanded our nursing school. We're training teachers now. We're training clinical nurses now in the thousands. This is
Part of our reforms in the Federal Ministry of Health to rejig the health sector. Whether or not you agree would state that our biomedical schools leave a lot to be desired. And frankly, Honorable Minister of State, I want to say thank you for this great initiative, because where we are going to from today is a significant milestone. A very significant one, not just for Federal Ministry of Health, but for Nigeria in general. And we want to thank our dear partners, JNCI and GE, for agreeing to this Memorandum of Understanding that will be of benefit to our pupils in our biomedical schools.
Comfort Olayinka, Eco Hot TV.